So today I'm going to talk a little bit about art therapy and how it can be used in conjunction with treatments to aid, mental diseases or disorders. I don't want to offend anyone in how I reference that name, but it can be used to help treat autism, schizophrenia, anxiety, depression. Now, this is the title of the study. You should be able to see it here. And they even talk themselves about how, and it's a meta-analysis study, so it looks at multiple studies and their results and wants to see how useful art is in conjunction with other treatments for mental disorders, diseases. Those are the names they use for it interchangeably. So first we've got a little graph here which helps explain, and they also write this how more studies need to be done and there needs to be more data. So yeah, just more needs to be looked into this before it can be implemented more really. Um, Next, I'm going to talk about, so you should be able to see it in front of you, talk about this type of things that the art therapy can be used to help aid. So we've got depression and anxiety here. If you look at Barcella 2007, they found that depression scores dropped from 9 to 7 before and after treatment. I can't say the name, but there's one in Germany you can see there which says anxiety scores decreased in a pre-post comparison. So, there's some evidence that depression and anxiety can, be helped with some art therapy. Now, what amazed me is they also found some benefits in cognitive impairment and dementia. I'll put those up now. Um, they found some benefits in Alzheimer's disease, which I thought was really interesting. I guess the cognitive impairment, dementia, and Alzheimer's makes sense because you're using your brain a bit more, you're helping stimulate it. In autism, they found some benefit, like in the third study for autism, autistic children showed more adaptive behaviors and emotions, and schizophrenia as well, which I thought was absolutely amazing to be honest. And the first study referenced there, Richardson, 2009, art therapy produced a statistically significant positive effect on negative symptoms. Yeah, I think it's great. I mean, I love art. I love being creative. I think it's very beneficial for my mental health. So not only can you use it day to day, but it turns out it might even be able to be used for you know more severe disorders or mental illnesses, however you want to reference that. And I think it's really cool. And I think some more work could be put into this.